And let's talk health now. Every year, millions of people around the world unite to shine a light on one of the most pressing health challenges of our time. On World Cancer Day 2026, the global community is renewing its call for awareness, early detection, and equal access to quality cancer care. According to the International Agency for Research on Cancer, 4 in every 10 cancer cases globally are preventable. The agency estimates that about 37% of new cancer cases recorded worldwide in 2022, roughly 7.1 million cases, were linked to preventable causes, highlighting the enormous but often overlooked power of prevention. Let's bring in consultant radiologist at the University of Abuja Teaching Hospital, Professor Ukamaka Itaye, who joins us on the news at 10. Prof, let's ground this conversation. When you look at Nigeria today, what cancers are Nigerians most commonly presenting with, and how late are most of these cases coming in?
Thank you so much for having me here. Currently in Nigeria, breast cancer is the commonest cancer, and then followed by cervical cancer, prostate cancer, and then you have the colorectal cancers. So these are the common ones. Of course, you have different types of cancer, especially those that occur in children. But unfortunately, studies have shown, and even from experience, that up to 70 to 80% of our patients will come in when it's already late, probably at stage 3 or stage 4, when it has spread to other parts of the body. And so that is the problem that we are facing.
The theme for this year's observance has to do with being united by unique. In practical terms, what does people-centered cancer care look like in a country where many patients are still paying out of pocket or arriving at advanced stages, as you've said?
Yeah, honestly, that is a problem. And I think that's why the theme is supposed to run for 3 years, from 2025 to 2027, because they just want to emphasize the importance of person-centered care. And so what it means is that we need to begin to look at patients not as their disease, but as holistic persons, because their experiences are quite different. And so in a country where you have a lot of taboos, we have stigmatization, and people are paying out of pocket, it becomes really very difficult to follow what the global trend is. However, when we're talking about being united, what we mean is that individually and as a community, we can come up with innovations that are peculiar to our surroundings and something that we can actually use, taking into consideration our cultural differences. Unfortunately, we tend to look at what is happening in higher income countries and we try to export them to our nation. It really isn't working. And so what we have to do as a nation is that we have to start from the community. So instead of starting from the teaching hospitals down, we have to start from the communities and begin to create awareness and to have innovations that will actually work for us, because a lot of other African countries or low-income countries have been able to do it. And I think that we can actually do it in Nigeria if we decide that we're going to. So it just means that we all have to be united, come together, and work towards reducing the burden of cancer in the country.
It sounds good, Prof, but it also boils down to who's going to pay for it. Talk about screening, for instance, that has often been mentioned, but uptake remains low. They say pay attention to your health, go for screening. Who's going to pay for it at the local level?
That is a problem. And I must say that part of the NHIS takes care of part of screening. But beyond screening, of course, you have the treatments. But I must tell you that although the screening imaging for screening, you find that a lot of people don't even make use of it. And so it still boils down to lack of awareness and apathy. So even when you have these things that are available, sometimes they're even sponsored by non-governmental organizations, people are still not even coming forth because of the several taboos and religious and cultural beliefs. And so these things end up being limitations. However, I must say that when it comes to the area of treatment, that the government is partnering with private organizations to make cancer treatment available. So in some areas, so there are some teaching hospitals that have been earmarked for this, and I think about 6 of them are functioning now. And so the patients are able to access complete care from those hospitals, but of course it's limited, and we're hoping that eventually it will get to every other teaching hospital.
And there are also many other people claiming to have a cure for the disease. Do you think it's about time we need to start paying attention to them and explore homegrown alternative solution?
Definitely. That's why I talked, I mentioned about innovations from our own end, because we need to begin to look for solutions, within ourselves. But at the same time, for you to have a cancer treatment, it has to be scientifically proven. Unfortunately, a lot of these cases are just coming out on social media to make claims, bogus claims about treatment. But they have to be able to allow others to actually scientifically try out these treatments that they
Correct.
offer. And when that is done, then I can assure you that it will be accepted, just not just in our country, but internationally.
Consultant radiologist at the University of Abuja Teaching Hospital, Professor Ukamaka Itai, thank you for your insight.